Based on the information we have, we can confidently diagnose Robert with major depressive disorder, severe, with suicidal ideation or behavior. We have indeed ruled out bipolar disorder, any possible medical cause of the depression, and alcohol or substance misuse. Our main goal is to reduce the frequency and intensity of his depression, anxiety, and suicidal ideations and restore meaning, purpose, and value back to his life so that he can fulfill his goal to be there for his wife during this time and also for his children as they progress through their adult lives. Robert has been in individual therapy with a CBT-trained therapist for the last several months. His wife Maggie often joins him in the therapy sessions, and even though he's very much attached to his therapist and likes the therapist and does his CBT homework faithfully, none of this has relieved his major depression and the suffering he endures from this condition. Regarding continued treatment, some potential options include using transcranial magnetic therapy or electroconvulsive therapy or starting esketamine nasal spray therapy. We're going to select intranasal esketamine and focus on this path for the duration of this activity. TMS and ECT are both appropriate choices and both are supported by extensive data in their ability to address treatment-resistant depression. However, the patient desires a quick response, which argues against TMS as an immediate choice. And although ECT is a valid option, the patient has expressed a preference to potentially reserve this treatment option for a later time point, if so needed. Esketamine is a prescription nasal spray used in conjunction with an oral antidepressant to treat adults with treatment-resistant depression or major depressive disorder with suicidal ideation. It was offered to Robert because its FDA indications make it suitable for Robert's disorder. Esketamine was evaluated in 2 identical Phase 3 short-term 4-week randomized double-blind multi-center placebo-controlled studies in patients with major depressive disorder with acute suicidal ideation or behavior. These adults had moderate to severe MDD with a MADRS score greater than 28 who had active suicidal ideations and intent. In these studies, patients received treatment with esketamine nasal spray, 84 milligrams or placebo nasal spray twice weekly for 4 weeks. After the first dose, a one-time dose reduction to esketamine 56 milligrams was allowed for patients unable to tolerate the 84 milligram dose. All patients received comprehensive standard of care treatment, including an initial inpatient psychiatric hospitalization and a newly initiated or optimized oral antidepressant monotherapy or antidepressant plus augmentation therapy. The primary efficacy measure was the change from baseline in the MADRS total score at 24 hours after first dose. And in both studies, esketamine plus standard of care demonstrated statistical superiority on the primary efficacy measure compared to placebo nasal spray plus standard of care. Esketamine, the S-enantiomer of racemic ketamine, is a non-selective, non-competitive antagonist of the NMDA receptor and inotropic glutamate receptor. Treatment with esketamine nasal spray is done on an outpatient basis. It is administered as part of a REMS program, which requires the patient to stay under observation for 2 hours after treatment administration. Additionally, blood pressure monitoring is a required part of the REMS program. Driving on the day of esketamine spray treatment is not allowed. A patient must have transportation back home after their treatment. The recommended dosage for esketamine nasal spray for TRD adults is, in the induction phase, which is weeks 1 to 4, to administer twice weekly. On day 1, the starting dose is 56 milligrams, but subsequent doses can be either 56 milligrams or 84 milligrams. In the maintenance phase, which is weeks 5 to 8, administer once weekly, 56 milligrams or 84 milligrams. And week 9 or after, administer every 2 weeks or once weekly, either 56 or 84 milligrams. The most common side effects, which are generally mild, of short duration include nausea, sedation, elevated blood pressure, and dissociative symptoms that can occur within 1 to 2 hours of dosing. Regarding drug interactions, esketamine may increase the sedation effect of CNS depressants and may cause increased blood pressure if used with psychostimulants or MAOIs.